Why are immunosuppressants vital after a CF lung transplant? Imagine giving your body a new set of lungs and then needing to teach it to accept them. That's where immunosuppressants come into play. After a lung transplant, especially for someone with cystic fibrosis, the immune system might see the new lungs as foreign and try to attack them. This is called rejection, and it can be very serious. Immunosuppressants are medications that help prevent this by calming down the immune response. They act like a shield, making sure the body doesn't see the transplanted lungs as a threat and attack them. Without these drugs, the risk of rejection would be much higher, and the new lungs might not work properly or could be lost altogether. There are different types of immunosuppressants used after a lung transplant. Corticosteroids like prednisone are common because they quickly reduce inflammation and immune activity. However, they can cause side effects such as weight gain, high blood pressure, and bone thinning. Monoclonal antibodies like basilicimab are used early on to help prevent acute rejection. These are special proteins designed to target specific immune cells. Nucleotide blocking agents such as mycophenolate mofetil and azathioprine work by stopping immune cells from multiplying. Calcineurin inhibitors like tacrolimus and cyclosporine are key players in long-term therapy but can sometimes cause kidney problems. In some cases, doctors might use mTOR inhibitors like sirolimus or everolimus, especially if there are issues with other drugs. For people with cystic fibrosis, immunosuppressants are especially important because they help the body accept the new lungs, which can significantly improve survival and quality of life. But it's a balancing act. These medications weaken the immune system, making it easier to get infections. That's why patients need to be extra careful. Good hygiene, avoiding sick people, and staying up to date with health checks are all part of the routine. Regular blood tests are necessary to monitor drug levels and side effects, ensuring the right balance between preventing rejection and avoiding infections or other complications. Taking immunosuppressants is a long-term commitment. Most patients need to stay on these drugs for life. That's why sticking to the prescribed medication schedule and attending all follow-up appointments are so important. While these medicines come with risks, they are essential for keeping the transplanted lungs healthy and functioning well. They have transformed lung transplants from a risky procedure into a life-saving option for many with cystic fibrosis. Always remember, managing these medications should be done under the guidance of healthcare professionals who can tailor the treatment to each person's needs. If you or someone you know is considering or has had a lung transplant, talking openly with your medical team about the role of immunosuppressants is key to a successful journey.